Assalamu alaikum wa rahmatullahi wa barakatuh. This study was conducted by Wang et al. And was published in October 2024 in the Journal of Endodontics. A case report discussing the management of large cyst-like periapical lesion using a Penrose drain, which is a soft, flexible rubber tube used as a surgical drain for decompression. For the case presentation, a 56 years old patient had a persistent periapical lesion associated with his maxillary lateral incisor 2 years after the non-surgical retreatment that included the retrieving of a separated instrument. The lesion had caused significant thinning and perforation of the surrounding bone structures, including the nasal fossa. A CBCT scan revealed a large low-density lesion measuring approximately dimensions of 17, 13, and 18 millimeters around the apex of the tooth. For the treatment approach, the patient opted for decompression over extraction. Following local anesthesia, aspiration of the lesion yielded about 12 milliliters of bloody exudate. The lesion was irrigated with saline, and a 6 centimeter long radiopaque Penrose drain was inserted into the cavity to facilitate the drainage. After 2 weeks, half of the drain was trimmed, and the remaining portion was removed with sutures. For the follow-up, 6 months follow-up, the decompression site had healed uneventfully, and at the 3.5 year follow-up, significant osseous healing was observed via CPCT. Although a bone fenestration and external root resorption were noted, the patient remained asymptomatic with class 1 mobility of the tooth. Due to the incomplete healing, root end surgery was performed 1 year after the decompression. A biopsy revealed a periapical granuloma, and root end resection was conducted. At the 4.5 year follow-up, there was complete osseous healing, and the patient continued to be asymptomatic with no signs of periapical pathosis. So, this report emphasized the effectiveness and simplicity of using a Penrose drain for decompression and managing a large periapical lesions. It also discusses the limitation of definitive histopathologic diagnosis during decompression and the potential for cyst-like lesions to shrink or transform over time. The healing process and the role of lymphatic access in resolving such lesions were also highlighted, suggesting that this technique could be a viable alternative to more invasive surgical options. And thank you.